Hi everyone, welcome to yet another episode of House of Cure presents Doc Talk. We have Dr. Ruhi with us today. But before we get into what Dr. Ruhi does and why we are having this chat, let me explain to you what House of Cure does. It's a novel concept. It's the first of its kind in India. It's a medical co-working space where doctors can come in, get their patients, work there, and they can leave. And it's completely on an hourly basis. And why this is a really convenient and a very good situation, good kind of situation for all the doctors is because they don't have any administrative load, none of that nonsense. While that it takes to set up your own clinic, we've done all the we'll take care of everything for you. The waiting room, all the rooms are sanitized, sterilized, all of it. So we look forward to seeing all of the doctors out there at House of Cure. And Dr. Ruhi is going to be joining House of Cure very soon. So Dr. Ruhi, why don't you tell us what you do?
Hi, thank you for having me. And thank you for, giving me this space. I'm Dr. Ruhi Satija. I'm a psychiatrist and psychotherapist based in Mumbai. I have my own practice in Matunga, Divine Mind Clinic, and now I'm so glad that I'm joining House of Cure as well. I've been looking forward to this for a long time, and because of certain reasons, it got a bit delayed. But I'm really loving your center. I know how beautifully you have created it, and I know the intention behind it as well. And I do agree with you. The space that you have created, with so much stress, especially in the mental health job, it's easy for me when you have taken care of the rest of the stuff, and all I have to take care of is my patients. So
Right.
I'm really looking forward to starting my practice there and, hoping to help as many people as possible.
Thank you. So, Dr. Rui, could you tell us what your profession or your specialty entails?
Yes. So I am a psychiatrist and a counseling therapist. Basically, I have expertise in anxiety management, stress management, depression, various mental health disorders. I have also expertise in women's mental health, especially perinatal mental health and postnatal mental health, which is related to the pregnancy, pre and post that, and also addiction medicine. So these are some of the areas that I with the medications because I am a psychiatrist. Plus, I do take therapy sessions as well because I have training in CBT, which is cognitive behavioral therapy.
Right. Wow, that's a lot of new words for me, to be honest. Uh, what
Okay.
what would be the difference between a psychiatrist, a psychologist, psychiatric
Right.
therapist? What are the differences? Because right now, I mean, as a layman, even though I am a dentist and I have some knowledge about this, I have no clue as
Right.
to what are the different fields in this particular in this particular niche. So could you enlighten us
Right.
on that?
Yes, this is a very important question, and please don't mind it because most of the people have this question because it's not very clear and not often talked about. So, a psychiatrist is an MBBS doctor who has done the basic MBBS graduation, and on top of that, they do specialization in psychiatry, which is mental health disorders. So, basically, a psychiatrist takes care of the mental health issues with medications and a little bit of different therapies per se. Whereas a psychologist is somebody, it can be a BSc or a BA psychology, a graduate of commerce or arts with specialization in psychology as a background. And then there are different types of psychologists. When we talk about mental health issues, there are particular ones which are called clinical psychologists, which are trained with working with patients of mental health issues such as depression and anxiety. Then, on top of that, there are some psychiatrists who get specialized training in various therapies, like myself, for example, CBT. So, we take therapy sessions also. But if you have to broadly ask me, psychiatrist is the one who gives the medications, a psychologist or a therapist is the ones who does that talking therapy. You have 1 hour session where you
Okay.
talk to the person and they give you some advice based on that. They teach you some techniques, they teach you how to work on your thoughts, emotions, etc. Having said that, some psychiatrists like myself do take therapy sessions as well if they have been trained in a particular way. So
Right.
that's where I come in.
Okay. Now you said
Yeah.
that you specialize in prenatal and postnatal therapy, and
Right.
due to this
Maternal
entire
therapy.
COVID time, maternal therapy. Now, due to this
Yeah.
entire COVID time, have you seen like a rise in these cases? Because there are a lot of lockdown babies that have
Yes.
happened. So
Absolutely. Absolutely. So see, what happened is with the lockdown, the anxiety, already the people who had anxiety, their levels increased much more. They became
Right.
much severe because the vent out was not there. Lifestyle changed extremely. They didn't have much of resources also. And some people, if they had even mild anxiety, or initially they had random anxiety episodes, they didn't have an anxiety disorder, but because of the so many pressures and the triggers that happened, it became a disorder. So definitely there was a rise in the numbers. Also, it could be possible that the numbers are already there, but the awareness increases. In these 2 years we had time to contemplate, we had time to think about, read a
Right.
lot about these things. Then there was a lot of awareness campaigns done, so the people who already have the issue but never talked about it were able to access healthcare. Also, because of the lockdown, one thing that surged a lot was the online consultation. So I used to do online consultation before as well, but because of COVID, this became like the mainstream. Initially it was much of a struggle because not everybody was convenient, comfortable with the online consultation.
Yeah.
Having said that, now this has become a preferred modality, especially in psychiatry, for the reason that it maintains the privacy also. Not
Correct.
everybody is comfortable in coming to the clinic, walking into a psychiatry setup, and
Right.
sometimes
Absolutely.
there is a lot of stigma associated with these issues. So
Yeah.
online consultation and online therapy sessions give them that privacy and space, and also comfort of home, right? You don't have to travel, especially in a city like Mumbai. It takes one and a
Correct.
half hour to reach a doctor, then 1 hour therapy session, and then again 1 hour back. So that takes a lot of time. But then definitely we can say that sometimes it is the face-to-face sessions that are much more valuable and create a certain environment and a certain comfort level, which won't work in all of the patients. So in some patients, the online sessions don't work that much because it requires a certain level of comfort with the therapist. So in that case, we need a physical space, and that's where the clinical setups and all of these spaces come in.
This is
So
common.
definitely online consultations have helped to a certain extent because of the availability and accessibility. Now everybody who is not there in Mumbai does not mean they shouldn't have access to good doctors. Because of online consultations they were able to. But
Right.
definitely one-on-one consultation, face-to-face consultations have a certain speciality to it and an edge to it, which works.
That's amazing. Uh, okay. Besides that, yeah, is there anything that you think that you would want to, let our audiences know as, say, like a take-home message from, your field? Since you
Right,
have whatever experience, especially in the last 2, 3 years, 2 years,
right,
with the COVID times, there must be
right,
certain situations that are coming across to you more often than normal, and you might have a take-home
right,
message for viewers, so they watch out for those signs, and they can
right.
handle themselves a little better.
Right, wonderful question. So I'll answer this in two different categories. One is the mental health disorders, where the patient actually has some depression or anxiety or any other mental health issue going on. So the message to them is that do not wait for it to become so severe that treatment becomes even more difficult and prolonged. What
Hmm.
happens is they wait for it that it will pass on. This is a common perception with depression, that if you will just go for a walk, if you will start yoga, it will settle down. But that does
Right.
not happen. If you have a disorder, it's not going to go away just with these therapies. So you require a certain treatment. So you should start that as early as possible. And then the second category of people who do not have a disorder as of now, thankfully, but are either on a verge of it, or even if you're struggling in any area of your life. It's a misconception that you need to have depression to go to a therapist or a counselor. As simple as relationship issues, as simple as confidence issues, self-esteem issues, all of these things, whether you are feeling underconfident in solving something, sometimes they have social anxiety, sometimes they have stage fear, anything and everything, wherever you feel that this area of my life I'm not really good at and I would like to work on, therapy helps. It is as simple as that and as complicated as that. So you need to see that if you are not comfortable in any area of your life, or if you're suffering in a particular area of your life, just go to your therapist, hear them out. It's not like the first session that you go. Another misconception is you walk into a psychiatrist office and all they'll do is start medications. Doesn't happen, right? In fact, to many of my patients, the medications are not even required. I only tell them that they come in with the perception that they will need medication, and I tell them that the symptoms are not that
Good.
severe. We can just start with therapy and see where it goes. If required, we'll start medications later. That also happens. So just go to a psychiatrist, get an opinion first, and then decide what is right for you. You have the decision. Ultimately, it's your decision whether you start the treatment or not.
Right.
But definitely going to a psychiatrist or a therapist, getting an opinion, having an action plan in hand that this is what are the possibilities in front of me is a very good way to go in life. You should always have an umbrella of security that if this happens, this is what my options are and this is all that I can do. And that's where we come into, help them as much as possible.
That's amazing. Dr. Ruhi, we are looking forward to having you at House of Cure and helping so
Yes.
many patients. And I hope this video reaches out to a lot of our patients and they understand the importance of mental health and the importance of seeing a therapist, and
Right.
how it can help them in so many different ways to enhance their personalities and enhance their lives. So thank you so much, Dr. Ruhi. I think this
Absolutely.
is a good chat.
Yes. And I'm looking forward to come there as soon as possible. Thank you. Thank you for having me.
Thank you very much, Dr. Ruhi.
You're welcome. Take care. Yes. Bye bye.
You too.